Hi there, I'm Bianco, and this is my Bernie 2020 session. I support Bernie Sanders because Bernie Sanders has supported us for decades. He's the only presidential candidate that consistently puts people before money.
Do you wanna go? Do you wanna go down with me? Don't think of yourself, I've got all that you need. In the backseat, like you told me, in the raw summer heat. Bring your heartbeat and your ketamine and the smell of chlorine. And the smell of chlorine. Hello. Streets with the bare feet in the warm summer heat. Bring your heartbeat and your ketamine and the smell of chlorine. And the smell of chlorine. And when will you know that I'm what you waited for?
Good evening, everyone, and thanks very much for being with us tonight for a program that I think is going to startle you a little bit. We're going to talk about an issue that does not get talked about too much in the mainstream media. It is a tragedy taking place right now. It's only going to get worse unless we stop it, and that is what is happening to prisoners all across this country in the midst of the COVID-19 pandemic. How are people surviving or not surviving in jail as we speak? and what can we do to stop the incredible number of deaths and other illnesses that are currently taking place. So we're seeing a spread of infections to some 20,000 inmates throughout this country, 20,000. I think the latest number that I've seen is 300. We'll talk about those numbers. My guess is they underestimate the severity of the problem. And with us tonight, we have 5 wonderful guests who are extremely knowledgeable on the whole issue of criminal justice and the impact of COVID-19 on inmates across the country. Lauren Brinkley-Rubinstein is a PhD at the University of North Carolina at Chapel Hill and a project investigator for the COVID Prison Project, where she is currently monitoring the spread of the coronavirus in our prisons and our jails. She will be followed by Larry Krasner. Larry is the district attorney in Philadelphia. He was elected in 2017 on a platform of reducing the number of people in jails in his city, of understanding that it is a lot more cost-effective to provide education and jobs to people rather than just to lock them up. Then we're going to follow with Justin Bamberg. Justin is a state representative in South Carolina. He is also an outstanding defense attorney. And Justin is currently working to ensure that people in prison can get health care when they need it, and is representing families who have loved ones who are currently incarcerated. We are going to follow Justin with Tracie Gardner, who is the Vice President of Policy Advocacy at the Legal Action Center. Tracie is an expert on how the crisis is affecting low-income communities and incarcerated individuals. And last but not least, we'll hear from one of the leaders of the criminal justice movement in this country, somebody who's been in the forefront of that fight, and that is Shaun King. Shaun has recently formed a large mutual aid society and is working tirelessly to get low-level offenders and prisoners with strong pre-existing conditions out of detention. In other words, he's trying to save their lives. Now, I don't have to tell anybody that this is an unprecedented moment in the history of our country. It is a terrible moment. And 30 years from now, and 20 years from now, and 100 years from now, people are going to be writing about this moment. They're going to be looking back on this moment. And what they're going to be pointing out is not only do we have the worst pandemic in 100 years, the worst pandemic since the Spanish flu of 1918, but simultaneously, we have a severe economic crisis, the worst economic crisis that we've had since the Great Depression of the 1930s. So what we're looking at nationally right now is a situation where over 75,000 Americans have died from the coronavirus, and that is a low estimate. Over 1.2 million people have been infected. That is a low estimate. And then economically, as a result of the shutdown and the stay-at-home orders all over this country, over the last 6 weeks, some 30 million Americans have filed for unemployment. And the number of people who have actually lost their jobs is much higher than that. It's unbelievable. You add those things together, and we are in an unbelievable moment in American history. And obviously, some of us in Congress are working hard to try to address that crisis in all its ramifications. We're trying to make sure that every worker in America continues to receive a paycheck. We're trying to make sure that during this crisis, at least, healthcare becomes a human right. And that if you're uninsured, if you're underinsured, if you have private insurance, but it doesn't cover your needs, Medicare will cover you, because we believe that all Americans should not hesitate to go to the doctor, should not go bankrupt with a large medical bill. Right now, we are trying hard to make sure that everybody in America has the food that they need. I just read a study the other day, 20% of the children in America, the wealthiest country in the history of the world today, 20% of the children in America are struggling to get the food that they need. And you're seeing in state after state, including my own state of Vermont, long lines, people coming out, National Guards coming, distributing food. People are coming out of the woodwork who have lost their jobs, now need food. We're trying to save the Postal Service, which is under severe attack by Donald Trump and his friends. So we are working hard to demand that there be a new emergency bill that is passed as soon as possible, which addresses all of the basic needs of the American people who are hurting so badly in this country. Right now, people who are watching this program, they're wondering whether or not they're going to get evicted from their apartments because they can't pay their rent. They're worried about whether they're going to lose their homes because they can't pay their mortgages. They're worried about the future of their credit ratings because they can't afford to pay their medical debt or their credit card debt or whatever it may be. So we've got a crisis, and as a nation, we have got to come together. This is not a time for Trump's tax breaks for the rich. This is a time for Congress to stand with working class people all over this country. And let us be clear, everybody in the country is hurting. Everybody, all groups of people are coming down with the virus, and the rich dying as well as everybody else. But make no mistake about it, this virus is impacting most severely the working class of this country, and generally speaking, disproportionately Black and brown people. Those are the folks who have to go to work. They don't have much of a choice. Those are people living in overcrowded apartments. Those are the people who in many cases have pre-existing conditions, which this virus is viciously, in a sense, taking advantage of and killing. So that is where we are as a nation today, in an unprecedentedly difficult moment. And in the midst of all of that, we got other problems. A couple of weeks ago on this live stream, we talked to folks who are very knowledgeable about what's happening to the undocumented in America. So you think, everybody's got a problem out there. Every working person has got a problem. Over 30 million people have lost their jobs. But you know what? If you're undocumented in America, you're not going to get any federal help. You're not getting that unemployment check. You're not getting that $1,200 rebate. You're not going to be eligible for small business loans and grants. And we talked about that subset of Americans. Today, we're going to talk about a group of people who are even in more desperate shape. They are trapped. They are trapped behind bars in local communities, in state facilities, and in federal facilities. They are in jail while the coronavirus is sweeping their facilities. So that's the issue we're going to talk about tonight. And before I go further, let me remind people, if they want to sign up for our newsletter, it is berniesanders.com/updates. Do that. And also, let me thank Bianco, who gave us her great music a few moments ago. Bianco, thank you very much. And now we are ready to go. And we're going to start with Lauren Brinkley-Rubinstein. Dr. Rubinstein, as I mentioned, is an assistant professor at the University of North Carolina. And she is going to give us an overview of the crisis that we're talking about tonight. Lauren, thanks so much for being with us.
Yeah, it's my pleasure. Thank you for inviting me. And I'm going to share my screen. Okay. So I'm here and I'm delighted to be here. So thank you for the invitation. I'm really going to talk about the COVID Prison Project, which is an initiative that I started with my colleagues, Catherine Nowotny and Elise Worsell. And before we dive in, I really want to acknowledge Sophia Mohammed, who's a student at the University of Miami, who made this logo for us, which is based on the concept of viral injustice. So 2 points of important context before we dive in. I'm here to give the data, but it really would be wrong to discuss the numbers without explicitly describing incarceration as a socio-structural determinant of health that targets people of color and exacerbates racial health disparities. In the context of COVID-19, prisons and jails have not been the focus of proactive intervention, and this inaction will only further exacerbate these disparities. And then the second thing I really wanted to talk about is correctional settings and how they amplify risk of transmission. So correctional settings, jails and prisons, are really unique in a couple of different ways. One is the built environment of facilities. And so these are congregate living facilities in which people eat together, they recreate together, they often sleep and live in dormitory style halls. And because of this, it becomes pretty impossible to engage in social distancing. These facilities are also at baseline overcrowded. There are also some policies related to prisons and jails that make it difficult to engage in prevention activities. And so those include the inaccessibility of hand washing supplies or so soap and hand sanitizer. There are also often medical copays in place that make people reluctant to report symptoms or engage in trying to contact medical. In addition, people have started to use conditions that really mirror solitary confinement as a way to quarantine folks. And so that also acts as a barrier to seeking help if you suspect that you have COVID-19. And I think the other important thing to mention is that on average, people who are incarcerated tend to have at least one chronic illness. So the burden of chronic disease is higher among people who are in jails and prisons. And there's also an aging population. So about 11% of those who are incarcerated are aged 55 or above. And that just puts them at increased risk of severe suffering from COVID-19. So now I'll get into the data. So the COVID Prison Project was an initiative that was started about 6 weeks ago when we started looking around to see what data we could find that was publicly accessible from the state prison systems, the Federal Bureau of Prisons, and ICE facilities. And so here we can see that over the last 5 or 6 weeks, there's been exponential growth over time. These numbers are as of yesterday. And so, Senator, you mentioned that the number is actually closer to 20,000 today, and that's correct. And this number is, so if we think about it, 19,000 people, there are 1.3 million people who are in prisons in America. That's about 1.5% of the prison population in particular. And that's about 4 times higher than the proportion of people in the general population that have COVID-19. And the confirmed positive case rate is higher in the prison population than the general population in 28 states. And we can get into that maybe more in the discussion, but it's important to note that states with higher prison populations that have these rates, it's really a result of testing. And so we've seen testing initiatives only happen in the context of outbreaks. So in many of these states, there have been outbreaks that then have pushed the prison systems into engaging in more comprehensive testing. If you look at deaths, we see that over time, the number of deaths have also grown. I think what's important to note is that there are around 350 deaths as of yesterday. If we look at this week alone, we can see that as of yesterday, which is just midweek, we've got 129 deaths. And so that's a big jump from previous weeks. So I think this is an important number to pay attention to. And what often happens is that when we have facilities that aren't engaging in testing and haven't identified cases, we start to see deaths compile, and that's how they know that COVID-19 is in their facility. So this is an important number to watch. It's really important to talk about staff in the context of COVID-19. So about 6,000 people who work inside of prisons have tested positive. There's some important caveats with this number. Almost all of the states are not engaging in robust testing of their staff. Instead, they're asking staff to go to community clinics to get tested and then to self-report back. And I really want to leave this conversation really making a call for the need for more testing. So for staff, prisons should be testing people that work for them, and they should be prioritized for testing the same way that other first responders are. So police and fire are often prioritized for testing. That is not the case for correctional staff. And this is really important because staff are the main connection between the community and the prison. And so they're moving in and out, and so they can exacerbate transmission in both settings. In addition, as I mentioned before, robust testing in prisons among people who are incarcerated is really only taking place when it is very apparent that an outbreak has already occurred. And this is in many ways immoral. We should treat testing as we do in other congregate settings, and we should prioritize prison and jail populations for testing, even when there's asymptomatic people, even when there aren't that many cases, because we know in settings, transmission spreads very quickly. So I'll just leave by saying not testing robustly and proactively really reveals our societal biases and amplifies what activists have long known and what I suspect we'll discuss more on this panel. We need radical reform to reduce the harms associated with mass incarceration, especially now, but we also ought to walk through this door and sustain some of the progressive reforms we've been able to enact.
Okay. Lauren, thanks very much for that presentation. Let's go to Larry Krasner. Larry is the District Attorney of Philadelphia. Larry, thanks for being with us.
I'm delighted to be here. It's always a pleasure to have a chance to talk to you, Senator. I would like to underscore something that Dr. Brinkley-Rubinstein just said. We have a county right outside of Philadelphia where they tested all of the inmates, and they found that the rate of actual infection from the virus was 30 times the number of reported cases. It was effectively 3/4 of the population of the prison. Needless to say, it is often asymptomatic, and there isn't the best medical care there. I have little doubt that if you were to check all of the people who work in those facilities, and it's not just guards, it's also social workers, it's all kinds of people who come in to do maintenance work and come in to bring food and things of that sort. If you were to check them, you would find that this is a sweeping problem within those facilities. So, it's extremely important what we do now in terms of addressing this issue. Philadelphia has had, I would say, mediocre success as compared to some other jurisdictions. We have gone from a level of incarceration several years ago in the county of 10,000 to about 6,500 when I took office, which was 27 months ago. And then based on various policies in our office, cooperation with some of the partners, we got it down to 4,800 at the beginning of the pandemic. It's now about 3,800. We've had a reduction of about 1,000, about 20%. But there are other jurisdictions where they did it much more quickly. They have done it to a higher percent. Pittsburgh being one of them, and a comparable because it's the other leading city in Pennsylvania, where the probation department was way ahead of the curve, and before the courts shut down, went to the judiciary with 250 requests to lift detainers because they were on top of it. Compare that to what happened in Philadelphia, where, yes, we have made progress more recently, but it was weeks late. And frankly, it was a pull. It was the public defender and the DA's office together pulling because we saw what was coming and we knew that we needed to do better than that. So that is part of the story. But I really think in many ways, Senator, the most interesting part of the story is not here yet, or maybe the most challenging part of the story. And that is what happens when courts reopen. Courts have been closed in Philadelphia now for about 6 weeks. They're expected to reopen in June. What court looks like in Philly is you jam about 4,000 people through the front doors of a building between 8:30 and 9:30 in the morning, and then they disperse into 30 different courtrooms and sit next to each other cheek by jowl. They're jammed in the hallways, they're jammed in the bathroom, they are jammed in the jury box. That's the reality of what's going on. And this court system is going to have to morph to be able to do some things remotely, maybe not jury trials. But if it can't, then I'm telling you right now, you're not going to see jury trials happening very much before probably somewhere between September and January. And even then, there will be complications. If we are not able to use modern technology to do remote courts and to do it in a way that does not resemble the Star Chamber proceedings that this country ran away from, then what you're going to have is a severe backup in the ability of the court system to resolve cases. It is going to force an increase in incarceration. If we do not have accountability so that the public, as is constitutionally required, can see what's happening in those courtrooms and the press can see what's happening in those courtrooms, the situation is only going to be worse. So to me, in many ways, this is the new frontier, and it's going to determine a lot of what we can accomplish over the next couple of years. We got a phased reopening of society. We're going to have a phased reopening of the courts, and we're going to have the ability to appropriately embrace remote courts while ensuring rights of public access if we are to do anything but have a closed exit door to the jail and an open entrance door to the jail. That is, I think, perhaps the most daunting and serious challenge we have.
Larry, thanks very much, and thanks for the work you are doing. Justin Bamberg is a member of the state legislature in South Carolina, is a prominent defense attorney in that state. Justin, thanks so much for being with us.
Thank you, Senator. And I appreciate you having me on. We've got major problems going on right now. And I think before we even get into the COVID-19 discussion, we've got to remember that even before this, our prisons were overpacked. We had shortage on correctional officers. Prisons struggled with adequate health care, adequate resources in places like South Carolina and many states across the South, adequate funding. So now you move in COVID-19 and a bad problem is just compounded. South Carolina is no different than a lot of states, again, pointing to predominantly those in red states. We got started late. The South Carolina Department of Corrections here did not even start preparing for COVID-19 until February. It's not like we didn't have TVs and couldn't watch what was going on in China and other parts of the world. We got started late. And that has compounded things so drastically. When we look at the numbers, I believe the beginning of May, it was reported 70% of inmates in federal prisons that were tested positive. I think the number is probably more like 90%. I don't think we'll ever get the actual numbers. I don't think we'll ever test enough of the inmates. We do have, for example, in South Carolina, when COs arrive to work, they get their temperature taken, they're given PPE. There are some protections in place, but we just cannot do enough to insulate the inmates. One thing that's we run into this issue anytime we're discussing, quote, prisoners or inmates, right? We can't forget they're people. And when you look to states, for example, Michigan, where just recently there's massive protests from people, you see signs that say, the government is trampling on my constitutional rights to be able to leave my house and get a haircut, to go golfing, right? Those same constitutional rights that those folks are talking about, inmates still have, right? As citizens in America, you have a constitutional right to be free from what is deemed cruel and unusual punishment. I have received letters, phone calls from inmates and family members who say, my loved one is in prison, their cellmate tested positive, and he is still in the cell with my family member, right? We already know that those people who are more susceptible to death from COVID-19, right? The elderly, those with underlying health conditions. If we're not moving them, if we're not isolating them in a manner that is still not the equivalent of being put into solitary confinement, which is known to cause mental health problems in people, we've got to figure something out. Down in Florida, 54 Florida prisons have confirmed cases, and that number continues to go up. How do we address it? We've seen in county jails, for example, in Anderson, South Carolina, where the solicitor's office, the equivalent of a district attorney in some places, have released some people, those who have nonviolent offenses, very minor stuff. That is an option that folks are looking at. Can we do that on a larger scale as a state government or a federal government? Probably not. But we have to do something, because the last thing we need is a bunch of bodies on our hands. And when you look to states like South Carolina, recently home to the Lee Correctional Institutional riot, which was the worst prison riot in the last 25 years in America. We're bordering on the line of prisons in some states being unconstitutional by their very existence. And what are we going to do to address that? So discussions like this are very important. Thank you, Senator, for your leadership in this regard. And thank you to everybody who we'll hear from tonight.
Justin, thanks very much for the great work you're doing. Tracie Gardner is Vice President of Policy Advocacy at the Legal Action Center. Tracie, thanks so much for being with us.
Okay. Thank you, Senator. Can you see my screen?
Sure can.
All right.
That's good.
So, first, thank you very much, Justin. Part of the problem is we have dehumanized people who are in the correctional system, and by calling them inmates and prisoners, it keeps us distant from the fact that, maybe capital punishment doesn't exist. This is something someone just said right before we started, but it seems like we're allowing it to happen, given what's going on. Clearly, how did we get here? This is not new. The health emergency that we're seeing among people involved in the criminal justice system is the same health emergency that we've been living under since the heroin epidemic 40 years ago. We're still in an overdose crisis. And where the overdose crisis has landed hard is in Black and brown communities and for people who go in and out of the jail system. Correctional health and community health are inextricably linked. And that is by design, and it's by the systemic racism that embeds every institution in this country. If, for example, the healthcare system had acknowledged that people with substance use disorder, with addiction issues, and with mental illness were health problems, then we would not have allowed the abomination of a criminal justice system being a healthcare provider. In New York, we are trying to close Rikers, but there's also an acknowledgement that Rikers plays a critical role as a health service provider. We've allowed that. That is a reflection of our priorities. And so this is not an accident, and this will happen again. The virus can hurt or hit anybody, and we've seen that. But the impact highlights the inequities. We saw that with HIV and AIDS. Everywhere that we fail as a society to take care of vulnerable people, everywhere we fail to invest in communities instead of institutions like law enforcement and prison, we will reap the benefit, if you will, of that investment. And so we have a healthcare system that is struggling and has no plan for providing care to the very people we are advocating to be released. We need them out of the corrections environment. But then what? We have to have an infrastructure in the community that can support people being able to get well, stay well, whether they're COVID positive or not. And as Lauren mentioned earlier, people are dealing almost always with more than one health condition. It is not an accident that the very communities that are struggling the most have used emergency rooms as primary care. And that includes a lot of people who come out of the correctional environment. We cannot go back to the way things were before COVID. We cannot act like we don't know what works in an emergency or day to day. So, I think that my organization's been around for 40 years. We've lived through the previous opioid epidemic. We've lived through HIV. We've lived through this epidemic. And now we're seeing COVID attack the very people that we fight to defend every day. We've got to do something different. The definition of insanity is doing the same thing and expecting different results.
Tracie, thanks very much. And last but not least, I want to go to somebody I've known for a number of years. Shaun King has been a leader in the struggle for criminal justice reform. He is working hard to help elect progressive prosecutors and district attorneys around the country. And right now he is working to get low-level offenders and prisoners with strong pre-existing conditions out of detention. Shaun, thanks so much for being with us.
Yeah, I'm glad to be here, and I'm sorry if my connection is bad. It says that I have low bandwidth, so if you can't hear me, just let me know.
No, you're sounding great. You're sounding great.
Well, I really want to talk today about the power of organizing, and everybody here has spoken of the necessity of fighting for our incarcerated sisters and brothers. And what I understand is that all of these policies will kind of just stay conversations if we don't fight and organize behind them. I remember just now almost 5 years ago when local leaders in Philadelphia had the idea of supporting and electing Larry Krasner to be district attorney. It actually seemed like an outrageous concept, not just in Philadelphia, but it just seemed so far-fetched that Larry, who had been on the front lines of fighting for change for so many years, could actually lead the system. And so what I understand is that in this pandemic, what we see, and Senator, you've talked about it throughout our time together, is that if we don't fight and organize for the incarcerated, for the marginalized, if we don't fight and organize for the oppressed, they're not just going to automatically be included in the next congressional aid package. Governors aren't just going to just stand up and do right, really, unless we demand it. And so what we see is, even in states with Democratic governors and Democratic legislatures, even in cities with Democratic mayors and Democratic city councils, everybody who's listening still has to demand smart reforms, smart changes, particular policies, and you have to make clear that this is why you voted for your local elected officials. Everything that we need to see happen with incarcerated people in local jails, state prisons, and federal penitentiaries, the changes are all possible. They are popular among both Democrats and Republicans. It's something that we could get some real bipartisan movement for. I have been working over the past few days with deeply conservative Republicans in the state of Georgia on a very difficult case. And there are things that we can do that cross partisan lines, and study after study shows that people want incarcerated people to be safe and that they want less incarcerated people in this country. But we're stuck in this phase of wanting it, of hoping for it, of it even having sometimes 70, 80% support in this country, but not actually getting it. So you have to organize on the local level. What I learned through Larry, who is a hero of mine, what I learned is that most change in the justice system happens on the local level. Almost 90% of all incarcerated people are incarcerated through local district attorneys' offices. There are 2,400 of them across the country. We can change them one by one, county by county. We can change our policies one by one, city by city, county by county, state by state. We can fight for these things on the federal level, and the federal level really sets the tone sometimes. But I have seen over the past few years something that's really encouraged me at a time where it's easy to be discouraged about how hard it is to fight for change. I've seen smart policies pass. I've seen people in cities like Philadelphia, St. Louis, Boston, San Antonio, San Francisco be elected as new district attorneys, and they are making serious systemic change. And so it starts, and I'll close with this, it really starts with everybody who's watching and listening, making up in your mind and in your heart that you are going to fight for practical changes with criminal justice, with mass incarceration. And I have been surprised that when sometimes a few people, 5 people, 20 people, come together to fight for change, I have regularly been shocked and surprised at what they can accomplish together. Thank
Shaun,
you.
thank you very much. And let me start it off, and others feel free to jump. Let me start with Lauren, go back to Lauren. Nationally, when we talk about the number of deaths our country is experiencing, the numbers officially at 75,000, but you have a number of epidemiologists who are telling us that the real numbers are significantly higher. Do we have any reason to doubt, Lauren, that the numbers that you cited and that I cited of 300 deaths, 20,000 people infected in jails, that in fact, the real number is much higher than that?
I think that's absolutely correct. I think the number is much, much higher. We have seen a big lag in reporting, and so this is behind what is actually happening. And I think that some states, as I've seen it reported, they'll say we have one confirmed death, and then we have maybe many other presumed, but we have not engaged in an autopsy, or we haven't confirmed it in that way, and so they're reluctant to report it as confirmed. And so I think there are many, many more deaths, and I think eventually the light will shine on that, but it will just take time.
Justin, you mentioned a very important point, and we can get into it as much as people want. I want to stay on the COVID-19 issue, that in many parts of this country, before COVID-19, the prison system was barbarous, that people have been murdered, they've been raped. It is really, 17th century type of asylums that we're looking at. Say a word, and other people jump in. You, I suspect, have visited many jails. You have represented folks who are in jail. If somebody is in jail today, what is their life like? Why should they be nervous about getting infected?
I can't think of any other way to put it. If you're inside SCDC right now, your life is hell. It's a living hell. That is the best way to put it. Overcrowding, poor meals. In the wake of violence and outbreaks, people get isolated. I've seen our prisons go on lockdown for some people for 300 days, including inmates who weren't even involved, right? There's a funding problem, and I think to really—
Justin, if I could interrupt you, tell me about overcrowding. What does that mean in the prisons that you have visited? Tell us what that looks like.
What overcrowding looks like is you have units that have too many inmates and, one correctional officer for every 300 inmates. You have not enough space. You have adults, 40, 45 years old, who are forced to be inside of prisons that are supposed to be youthful offender prisons. So individuals ages 17 to 25. It's too many people in prison. And we have a very bad— the drug offenses, the prison sentences that are given for drug offenses are horrendous. That is something that we actively in South Carolina have been trying to address. We were working on sentencing reform just this year, and COVID-19 stalled that out. Why are simple possession or marijuana possession folks put into our prison systems in America when individuals like the gentleman who were involved in the killing of Ahmaud Arbery still free?
Exactly.
That is the question, right? And if we don't talk about the systemic historical problems of prisons, again, especially in the South, I don't know that we can fix the problem. We have to own it. We have too many people who are put in prison, nonviolent offenders, those with mental health. Right, a lot of our inmates across the country have mental health problems because when they were out, our governmental mental health systems, our healthcare systems, they didn't have insurance. They couldn't afford the treatment that they were supposed to get. And it's easier for government to just throw them away and lock it without the key, lock the cell, than it is to treat the problem, Bernie.
That's exactly it. That's exactly the point. And that the acknowledgement, again, between the link between correctional and community health is that most people come home again. We're not talking about the people who have been consigned to these ridiculously long sentences, but we're talking about a constant churn from inside of the correctional environment outside to the unhealthy community where we've made poor investments or we've chosen to put more into public safety than public health. I mean, that's what we're in the midst of now. And so anywhere in this country, it's especially egregious in the South, but anywhere in this country, any jurisdiction that suffered through bad, stupid drug policy, over-policing, mass incarceration, trust and believe around that Martin Luther King Boulevard, there is poor health, there is a broken education system, there is any number of the indicators, and you would think, people would have you believe, government would have you believe that is the fault of the people there, instead of really looking at the years built up of systemic attacks on the community, on the economic viability of the community. People know the research that has shown that even when one person in the family is incarcerated, it impacts the family's economic well-being and capacity for growth for 2 or 3 generations. So, this needs to be looked at in its broader context. This that we're seeing with COVID-19 is a huge magnifier on the inequities.
Larry, jump in. Tracie, I think, has made the point very well, that in many cases, our prison system becomes the healthcare system for hundreds of thousands of people who have mental health issues, all kinds of other issues. They can't get the healthcare, drug addiction issues, alcohol addiction issues. They can't get the care that they need in the community, which would be far more cost effective, far more humane. And so we end up dumping them in prisons and locking them up. Your thoughts on that? Can't hear you, Larry. You're on mute.
That's the first time I've been quiet my whole life. Anyway, I think Tracie is 100% absolutely right. We have dismantled the mental health system, and then we took people with mental illness and we put them in jail. We don't have a system for dealing with addiction, which is a disease, because we don't have proper public health, so we stuck them in jail. We have turned jail into just a place to throw everything that we don't deal with appropriately. Poverty really is what we're putting in jail in general. I mean, certainly there are many, many other categories, but it is a national disgrace. It is an international disgrace. It is a fiasco. And I would like to think that in this process of the pandemic, we're all going to learn something. I can tell you one thing interesting I learned in Philly, which is that when the police came down with a sensible policy not to arrest for a whole lot of nonviolent offenses, crime went down in all of those categories.
Crime went down?
Crime went down, and yes, there are reasons like that having to do with people being near each other, et cetera. But, the usual conservative expectation is if you cease enforcement, even for a couple of months, all the zombies will be running down the street and running in your front door. Not so much. We've actually had about a 15 to 20% decline in both violent and nonviolent crime, with the police announcing that they will be doing less enforcement and charges will be delayed. So we have to come and look at this in a way that is sensible, maybe even a way like, for example, modern Germany, where they simply accepted as a matter of statute, as a matter of right in modern Germany, that there is human dignity and that the purpose of jail is to reintegrate you into society with the capacity to work, with the capacity to speak the language, if you do not already, with a superior education. They'll pay you for that job. They'll pay you for that education because it's a good investment. And what do they have? They have a ninth of the violent crime. They have a ninth of the incarceration in a place that, let us be honest, knew how to do some pretty terrible things. They have found a way to do better. And I think we can do that too.
You know, it's funny that you mentioned that. My wife and I can't remember, 15 years ago perhaps, were in Sweden as part of a congressional delegation. And most members of Congress do what they do. I dragged her to a maximum security prison in Sweden. That was my interest. And you know what? Before we were able to get into the prison, this will blow everybody's minds. The guy there, the warden, was very nice. And he said, well, before I let you in, I have to talk to the prisoners' union. Got that? The prisoners' union had to approve my being able to go in. They didn't serve food. The prisoners prepared their own food using very big knives. This was maximum security. They had conjugal visits, all right? I mean, and what they were saying is just what you were saying, Larry. Their goal is to get people out, make them productive, tax-paying citizens, and not to waste huge amounts of money on punishing people. That was their goal. And I think, generally speaking, that works a hell of a lot better than the punishment system that we have. Anyone want to jump in before we got a lot of questions here, many. And anyone want to jump in with some thoughts?
I was just going to say, in the context of overcrowding, it has a direct impact on healthcare provision and the ability to be seen by a healthcare provider. There's the very important Supreme Court case, Brown versus Plata, which showed that if you do not have access to healthcare inside, it is a violation of the Eighth Amendment and cruel and unusual punishment. So very important to this conversation.
Okay, we got a number of questions here. Let me just glance through them. I don't know if anyone knows the answer to this. Mary Hale writes, quote, what is the current rate of infection in our prison system? Are prisoners being tested? So what is the answer? Anyone know? Are most prisoners being tested, or is it helter-skelter? What's going on?
Yeah, so I can answer the testing question. So the answer is no. And in what we've found is that testing is only happening when it's very clear there's already an outbreak. And so when officials' backs are pushed up against the wall, when they know that rapid transmission has happened, that's really only the cases where we're seeing full facility testing. We have seen that in Michigan, Tennessee, North Carolina, Arkansas, and some other states, but usually proactive testing is not on the table.
Okay, thanks, Lauren. We got a question from Mapia, who writes, it's an interesting question. Why is it important to not make a distinction between violent versus nonviolent prisoners when thinking about their safety?
I'll chime in on that. Again, it goes back to just human dignity and the fact that when you go to prison, you don't lose your status as a citizen of the United States. You have constitutional rights. They apply, period. If you are a nonviolent or deemed a nonviolent offender, or if you are deemed a violent offender, at the end of the day, your constitutional rights remain intact. You have the right to be free from unlawful use of force under the Fourth Amendment. You have the right to be free from cruel and unusual punishment. And the moment you are taken into government custody, you are in government custody. And the government has a non-delegable duty to make sure that your life, safety, and well-being are taken care of. They can't let you get shanked 100 times. They can't let you go if you have diabetes without getting your medical treatment. And in this particular instance, if you were, say, infected with COVID-19, they can't just let you lay there and die from pneumonia. The government has to take care of those things.
Okay, anyone want to add to that?
I do. So at some point, we're going to have to grapple with the nomenclature, right? Violent versus nonviolent. And so we are in a period of massive decarceration. And people with health conditions, at least before COVID, nonviolent drug offenses, letting people be free or not being in an incarcerated setting is what we were moving toward, recognizing that the orgy of mass incarceration wasn't making us any safer and sure as hell wasn't saving us any money. But if we really want to make an impact and be able to close prisons and maybe build some community centers and make those kind of investments that Germany and Sweden have, we're going to have to make distinction about what is violent and what is nonviolent. There are many violent crimes that do not involve a victim. Many times they're property crimes. Should someone do a 40-year sentence having been convicted at 18, what value does it give the community? What value does it give the tax base? And so I think what was mentioned earlier, that is a local and state issue, but the question has been called about if we want to seriously decarcerate, we have to take on that issue.
We lost Shaun King. Is Shaun, Chris, Shaun is not, we lost him, he disconnected there. Let me throw this out to Larry, because it's a very interesting question. I think a lot of people are thinking about it. Lisa Miller writes, how can the release of prisoners for the pandemic be used as a precedent for incarceration reform? And Tracie just touched on that as well. So we're releasing now in kind of an unprecedented way, I should imagine. What do we learn from that?
Great question. You know, obviously everybody is focused right now on stopping the spread of the disease, because the spread within the jail is, of course, what's going to kill, you know, our grandparents who have not stepped foot in a jail in their entire lives. The spread anywhere is the spread everywhere. But there are many times when we get to look back and see something we didn't expect, and it becomes this amazing experiment. So let me give you an example. If you look at what happened with the resentencing of juveniles who were convicted of homicide and who were either given the death sentence or they were given a sentence of life without the possibility of parole, nowhere had more of them than Philadelphia. It is the world epicenter of juveniles who were sentenced to life without parole or death for homicides. My administration handled the resentencing of over 100 of them. And what we have seen there is just amazing. What we have seen is that people who went to jail as juveniles believing they would never be free again, who were deemed to be monsters by society, so monstrous they would die in jail either from execution or just from the expiration of their lives, they have now come out now. And in Pennsylvania, in Philadelphia, a lot. We have seen 174 people who were resentenced come out. The recidivism rate is 1.5%, okay? Think about that for a minute. The recidivism rate among violent felons in general is about 30-some% in Pennsylvania, and the recidivism rate among people who have been supervised by county probation or parole in Philadelphia is about 50 or 51%. The recidivism rate among people who were involved in what was in fact a monstrous act, the killing of another human being, turns out to be probably about the rate of criminal activity for an average sample of the population. I say that this is an example of the kind of experiment that opens our eyes, because this is a keyhole. We get to look through this and we challenge the most fundamental proposition of our criminal justice system, which is that if you did a bad thing, it defines you. It is who you are forever. And therefore, you must be punished and locked up forever because you're never going to change. Well, here's the news. Brian Stevenson got it right. You are not the worst thing you ever did. And it turns out that in the same way that a society can change, that an individual can change who is not a criminal, it turns out that someone who has done even a terrible act can change very, very profoundly. And here's my final point on that, which still amazes me because I was personally involved in making recommendations on these resentencings. So many of these juveniles had achieved tremendous levels of rehabilitation before they ever knew that there was the possibility of freedom. They had gotten their educations, they had become stabilizing influence, they had ceased all violent and impulsive behavior in jail before they ever had any concept of the possibility of being free. So to me, this is another opportunity like that. It's one of those things that comes along and allows us to look back. It will be interesting to see whether there are lessons here. Those lessons obviously will be about what happens when society does what it doesn't want to do, which is let out significant numbers of people from custody, and then we get to measure a few things.
Let me just pick up on Larry's point and somebody jump in. Give us some examples around the country where states or cities, and Larry, you've given us a great example right now of what's happening in Philadelphia, where people who were condemned to hell suddenly come out, and turns out that many of them can be productive citizens. Give us some examples around the country of other programs which point us in a new direction for criminal justice. Who has any thoughts on that? Anything come to mind? Or not?
Well-
Justin, anything come to mind that you have observed that's working well?
Yeah. So, and it goes back to the big problem of when we talk about the prison system, we need more rehabilitation. It's too punitive right now, right? And I think that spills over into society because people look at those individuals who are incarcerated and it's lock them up, throw away the key, they're terrible people, they don't matter, yada, yada, yada. I personally know individuals who, while in prison, for example, there was a nonprofit called the Healing Species. I was involved with that. Part of what this program did was do animal rescue, but the other half of the program was taking rescue dogs into our prisons, including the maximum security prisons, and allowing the inmates, while incarcerated, to work with the animals. And they were allowed to take care of the animals, right? And what you saw is we were teaching compassion, education, and violence intervention. The program worked great. You saw a decrease in violence. You saw a decrease in aggression. And there are statistics to back this up throughout the life of that program. If you look right here, Senator Sanders, to my very own office, a good friend of mine, he is a barber who cuts his hair out of my law firm here in South Carolina. And a lot of people don't know this. He was in the South Carolina Department of Corrections for some 12 years. And he is one of the greatest, most decent human beings that I have ever met. He is involved in the ministry now. And it goes back to what Larry was talking about, is that, people are the sum choices of the decisions that they make in life, right? They're not defined by one period of their life. And if we don't address the problems in our prison systems in this state, much like you talk about, we're never going to be able to fix the problems. Right? We need to cut down on the incarceration rates. We need to rehabilitate these men and women and get them prepared to enter back into society and help make this society better. They're fully capable of that. We just have to figure out a way to give them a chance.
Senator, could I add one thing?
Sure.
In addition to what Justin said, we also have to deal with basically the pervasiveness of the scarlet letter called a criminal conviction. The example that Justin gave of the barber who did time, in many states, if you've done time, you can't get a license to barber. And so there's this notion of perpetual punishment. People have done their time, they come out, and then they don't get access to the very kinds of necessities that would reduce their likelihood of going back in. It's another example of our hypocrisy, right? You're supposed to serve your time. You're not the worst that you were, and you should go and be a, tax-paying, productive citizen. But we throw up all kinds of barriers, education, housing, to keep that from happening.
Okay, so let me pick up on that point. I learned, recently, in the last year, I mean, it's hard for me to believe it, and maybe some of you pick up on this. When people are in prison, depending upon the state, in some cases, they are charged for their room and board, yeah? They are charged for their health care. So pick it up on Tracie's point. You go into prison, you're poor, you got nothing, you may not have education, you don't have any money. And what, you incur a debt for the privilege of being in prison, and you come out worse off financially than when you started. Justin, is that, it sounds so crazy to me. Am I wrong on this, or what's going on there?
No, you hit the nail on the head, Senator. There's nothing worse, I think, than going in and let's say you serve 5 years or 10 years or even 1 year. And when you phase out of prison, you were given a couple of bucks and out you go, right? Well, you've got the roadblocks like Tracie was talking about, right? That's why we have this whole ban the box movement, for example, because people need to have opportunities to be productive, to get jobs. Even those individuals who get rehabilitated, right? They come out, they want to do better. They want to accomplish things. They want to go and, for example, a lot of guys, they want to go stop younger guys from making the same mistakes that they made, but they can't find a job. They don't have any money. They don't have any resources. They don't have access to health care. A lot of people don't want to even give them a chance because there's this stigma of everyone. Regardless of what you go to prison for, there's a stigma associated with the fact that you went there. And how do we address this? That is the question. And I think that some people say we have a policy problem. We have a policy problem, and we do. But we also have a people problem. And citizens need to make sure that they go out and vote for and support individuals who understand the dynamics of this, individuals who are willing to work on policies, get individuals like Larry in office who have the power to go in and implement these changes. That's how we're going to have to move forward.
All right. I have read that if I'm in prison, to make a phone call is outrageously expensive. Is that the case? How do I communicate if I don't have any money with my family? Anyone know? Tracie, is that true? Expensive? Making a phone call?
That is absolutely true. And in many cases, there's an unholy alliance between the correction system or the jurisdiction where the correctional system is and some profit-making entity that is able to charge these ridiculous rates. That is part of what's going on now, is people being able to make phone calls to make arrangements for where they're going to be if they're released due to COVID risk. And, it's something like $5 for the first minute and $1.33 for each additional. That's not an exaggeration.
All right, maybe our last question, which is an important question. MJ McGinley writes, where are released prisoners going to go if they tested positive? How do they support themselves? So we talked about thousands of people getting out of jail, and we think that makes sense. How do they afford the health care that they need? Where are they going to live? What's that about? Larry, you want to jump in on that one?
Sure. I really also want to talk a little bit about what Tracie just said, which I thought was wonderful. But so what's going to happen is they're going to come out, and in many instances, they're going to be homeless, or perhaps you will have a governmental program that will put them up in an empty hotel for a little while, or if we're extra super stupid, we'll stuff them all into a homeless shelter so they can be as close as possible to each other, which is really not a good idea. But the reality is it is not so different than what goes on all the time. We have people who come out of jail in Philadelphia and they are given a token on public transit and they are let out, or at least they used to be let out in the middle of the night, only to go back to a place where they may not have any home. So it's an extremely problematic situation, but it also may just be the only thing that we can do rather than have them in what is effectively a different senior home, a different cruise liner, a different meat packing plant where you're going to just have an incubator. Let me talk a little bit about the money side of it, though, because, sometimes we look at mass incarceration, we just sort of shake our heads at how terrible it is. And Senator, you have always been very eloquent looking at the money side of it. Well, look at this money side of it. Everybody talks about private prisons. Let's talk about public prisons for a minute. In Pennsylvania, they don't have coal. Sorry, they don't have coal. They don't have steel in all of these different counties. But what they have is jail. And jail's costing roughly $50,000 a year in terms of the price of incarcerating an individual for a year. Well, all that money goes into that county. It goes into the county to support a sizable payroll, all of the local businesses, the tax base, often the local schools. And here's where it really hurts. The people from Philly, where they do not have a state prison, who are housed upstate in a much more rural and culturally very different location, they are counted as residents of that county. So even though they cannot drive a car, they are residents for the purpose of federal funding of those highways. Even though they cannot vote, they are counted as voters in that county for the purpose of gerrymandering. We have a system where there is a profit motive in public prisons and there is a power motive in order to have what is effectively a commerce in human beings. It is extremely lucrative and power building upstate to take 13,000 Philadelphians, which is what they do, and stuff them in prisons upstate. And that phenomenon exists all over the country. All this mad love for mandatory sentencing, all of this affection for mass incarceration, this all comes from somewhere. And it's not just a bad idea. It comes from motivated politicians who will frankly do anything to guarantee their own incumbency, and they do so very cynically.
Wow.
It's absolutely surreal to hear a district attorney talk like this. I'm sorry, I'm just a little busy. Not in my time. The DA talk like that.
Well, what Shaun was saying, who was disconnected, is, that's what we have to do. We have to organize all across this country to elect officials at every level, including prosecutors, district attorneys, who have a very different perspective on criminal justice. And one of the areas which I've seen in Washington, interestingly enough, Larry, you talk about money, and it's pretty expensive. It's a lot more expensive to lock somebody up than to send them to a state university, for example. And some of the conservatives are beginning to catch on to that. Is there a way to deal with the issue rather than locking people up? Might it not be a better idea to invest in education, to invest in jobs, rather than in more jails? And from perhaps a different perspective, from a conservative financial perspective, some of my conservative friends are beginning to catch on that we're spending, what do we spend, about $80 billion a year locking people up. That's a lot of money. So let me conclude the evening by thanking all of our panelists. And let me just say to everybody who is watching, this is an issue where you can really have an impact above and beyond elections. Jails are controlled locally, they're controlled at the statewide level, and governors and mayors and others will respond to community pressure. So I think the time is long overdue for the United States to end the international embarrassment of having far more people in jail than any other country on earth. More people in jail than China, which is a communist authoritarian country. Okay, and so many lives, as we have heard tonight, are being destroyed above and beyond the COVID-19 epidemic. So with that, we got a lot of work to do. And I again want to thank the panelists who are with us tonight, not only for being here, but for how they have, to the causes they have dedicated their life's work. So thank you all very much for being with us tonight. We will see you soon. Thank you.
Thank you, Senator.